Hi there, I'm Dr. Gary Simonds, and I want to talk to you some more about hemorrhages that can occur within the brain and around the brain. We talked a little bit about subdural hematomas and epidural hematomas. Let's talk about intraparenchymal hematomas. Intraparenchymal. Now, that's a fancy term to say the bleeding occurred in the brain tissue itself. We were talking about how trauma can cause a lot of different types of hemorrhages, and indeed it can also cause an intraparenchymal hematoma. It does so often by the fact that the brain can be bruised in an accident, in a trauma. The brain moves around inside the head, and in areas where the brain is close to skull, when the brain moves around inside the head violently, the brain can slap against the skull. For example, the frontal lobes sit on a part of your skull, at the bottom of the skull, called the orbital roofs that are just above your eyes. And the brain can slap onto the orbital roofs, and you can get bruising, literally bruising of the brain where the brain slapped against the orbital roofs. Sometimes that bruising can get worse and worse over the next day and actually form hematomas, can form blood clots. Were they to get big enough and cause problems like a patient slipping off in a coma or progressing towards death, we would have to remove the hematoma. If they remain relatively small, they may not need to be removed. The same thing goes, by the way, for subdural hematomas, epidural hematomas, intraparenchymal hematomas. If they're relatively small, we won't operate on them. We'll watch them, and the body will gradually gobble them up. But if they're too big and they're causing too much problems, we have to take them out. There's no other good way. There's no medicine to take. Intraparenchymal hematomas can also happen spontaneously, meaning they can occur without trauma. And we'll talk about that more in a little bit. Another type of hemorrhage that can occur that you need to know about is something called a subarachnoid hemorrhage. There is a layer between the thick bag of fluid that the brain sits in and the brain itself that's very clear. It almost looks like saran wrap, and that's called the arachnoid. And sometimes you can get bleeding under the arachnoid. That often can occur from trauma, but it also can come from a very important source and something that we have to pay very close attention to, and that's brain aneurysms. And we talk about brain aneurysms in a separate section. We'll talk some more about hemorrhages, particularly intraparenchymal hematomas, in our next session. Thank you. Bye-bye.